What a great event. I wish I could have brought my manager with me so that she could see what you guys are doing. This is amazing.
I think today's event was actually very helpful for the Assemblyman's constituents from Simi Valley. There's a lot of confusion, there's a lot of angst in regards to healthcare reform.
Getting the doctors and the health plans and so forth coordinated with the community is what we should be doing more of. Outreach.
As seniors, we feel that this is very important to us, and it answered a lot of my questions.
It was such a positive, informative dialogue between the panel and the audience that I feel very positive about the changes that will be coming.
What Regal does is that they're looking out for the best interests of the patients or the participants in their program. You know, there's not very many. I'm with another competitor, and they're not educating me on what's out there, what's to come.
And what's to come was discussed in the 4th Community Healthcare Dialogue in an ongoing series sponsored by Dr. Richard Merkin, Heritage Provider Network, and Regal Medical Group in October in Simi Valley. The luncheon event was co-sponsored by the Simi Valley Chamber of Commerce and the Simi Valley Hospital.
I want to welcome you today to an important discussion. It's on healthcare reform. The federal government has passed the law.
Over 100 attendees listened to influential panelists, including Dr. Gary Hertzberg, Medical Director at the Regal Medical Group, Mr. Fred Bauermeister, Executive Director of the Free Clinic of Simi Valley, and Mr. John Beeman, the CFO of Simi Valley Hospital. The mayor of Simi Valley, the Honorable Paul Miller, moderated the panel.
Do we know what's going to happen between now and 2014 and what will change?
85% of the healthcare dollar as the baby boomers go forward will be spent in Medicare. So if you're not in Medicare, you're not in healthcare. So again, we have to grapple with managing a resource that's going to be absolutely necessary to care for really the demographic change that we're all going to experience with the baby boomers entering Medicare.
According to the UCLA Center for Health Policy Research, in 2009, 21% of persons 64 and under living in Ventura County were without health insurance. So what does that mean for health providers and for the hospital?
About 15% of the people who come to our emergency room don't have insurance. So about 15%. So on the surface, it may seem that if this 15% now have insurance, that's a benefit to us. What I see as the greater benefit, though, is if the hospital and physicians in the community can work together better, we can probably keep that 15% out of the ER in the first place.
Fred, what has been your experience in the last, say, 3 to 5 years with regard to people coming to the clinic? Do you find that it is increasing? Is it backing off? What's your experience?
It's definitely increasing. Last year we saw 11,762 people last year, which is the most we've ever seen in our history. We expect this year to be somewhat similar, and probably the year after to continue at those levels. And the people that come to the clinic today are sicker than the people that used to come to the clinic. Like John said, you know, we're trying there to keep people healthy and consequently out of the emergency room for the hospital.
What's in the legislation is the idea that a group of physicians and other healthcare entities, a hospital, home health, etc., would manage the health care of a group of Medicare patients at a minimum size of 5,000 people. And so it would be very much similar to a Medicare HMO type model, except that it's going to require really physicians and hospitals and other providers to work together.
I think what they're all going to be called are ACOs. Look for that term, Accountable Care Organizations. I work with Heritage and Regal, and this is what we dedicate our time to.
Not only did the event generate positive feedback from the community, news coverage was positive as well. The Heritage Provider Network and its family of medical groups are the country's leading example of a successful accountable care organization. Giving back to the community through these important healthcare dialogues reveals HPN's commitment to providing superior healthcare from cradle to grave.